Good afternoon, everyone. So I'm Prof Patrice, and I'm the program director for the Health Informatics and Analytics program. So welcome to everyone, and thank you for being with us. So I will present you briefly the Health Informatics and Analytics program that we are going to launch in September at IMU. And then Dr. Raymond Choy will explain to you the impact that this health informatics and analytics will have on healthcare. So basically, as you can see on this slide, the program structure of this program. So you see we have, in fact, 3 levels: PG certificate, PG diploma, and master. But in fact, you enroll in the master program. And if you don't want to do everything, then you can exit earlier. So basically, we have 2 semesters. The first semester is for everyone, and we have 4 core modules: health system informatics, data collection preparation, data analytics, data management, and research methodology and scientific writing for those who want to do the full master with a research project later, and 2 electives. And in the second semester, we have advanced health informatics and health data visualization. So these are the core modules, and it will give you the skills, the knowledge and the skills to do some data analytics, data visualization, and data management on health data. So, yeah, I said this is a 2 semesters program, and at the end of the second semester, or during the second semester, you will have to conduct a research project that can be done either at the university or in a company. So if you are already working in a company, you can propose something related to your work, in fact. And something very important here on the right side at the bottom: if you don't have any background in statistics and in computing, then you will have to take 2 specific electives at the beginning of the program. One about statistics thinking for health analytics, and the other one, introduction to computer science and programming. Okay, so if you have questions about this later, you can type your question in the chat box. Okay, next slide, please. So the entry requirements for these 3 programs, it's very straightforward, because you can enroll this program with a bachelor degree, any bachelor degree, not only science or healthcare, but it can be IT, it can be business. So any bachelor program is good enough, any bachelor degree is good enough to enroll in this program. But as you can see, and as I said earlier, those who don't have a statistical background, they must take a special elective at the beginning about statistics thinking for health analytics. And for those who have no background in computing, introduction to computer science and programming, 2 credits at the beginning of the program as well. So after this, everybody will be on the same level, and you will be able to see the data analytics, data management, everything related to health informatics and analytics. Next slide, please. So this program is focused on not only on working adults, but it is built so that working adults can follow and don't have any problem, any issue in doing it. So first of all, it's blended learning. So it means that depending on the situation with the COVID, normally you have online classes, and you should be able to come to IMU on Saturdays so that we can meet and work together for some of the classes that we have. So for the moment, we are developing all the content online, because we don't know how it will be in September, but hopefully we can meet you face to face on Saturdays. This program is also available part-time or full-time, depending on your schedule, busy schedule, and your work and your availability. So we will have online support from faculties, and we will use email, Zoom, or Teams session, and you will have support from us all the time. So not only on Saturday, but we will help you to work with us all the time. This program is project-based, and so all the activities and coursework are project-based. So it's not only theory, and it's not mostly theory, it's mostly projects. And based on the projects, activities, then we will explain you the theory behind it. And the final semester, 20 weeks of research or industry project. And you will propose some subjects, some topics that you are interested in, and we will tell you if it's good enough for the research project for this program. So it can be done either in IMU, or in hospitals or in your company if you are working in a company at the moment. So next slide, please. So quality is very important. That was one of the main aspects when we decided to build this program. So the curriculum has been designed with the help of health professionals and IT professionals as well. So of course, we are professionals, but we are academics, and we have consulted people from industry as well, people from hospitals and companies involved in healthcare. This program has been approved by MQA and Ministry of Higher Education. Faculties, you don't know me, but I have more than 40 years of experience in computer science, and I've worked with many universities in France and in Malaysia as well. And my colleague is also, Dr. Tan Ision, has done a PhD in Monash, and we have some other colleagues from IMU who are very experienced and who will work with us all the time. We will also have guest lecturers because we strongly believe that we must work with industry people. So leaders from industry companies will be invited to give some guest lectures for each of the modules that we propose. In each core module, you will see some guest lectures. And we are working also to get some renowned adjunct professors. Okay, the jobs that you can get with these programs, as you can see, health informatics, health analytics, specialist, analyst. It depends, in fact, on your background, and it depends on your interest. But it's very open, and it's not close to healthcare, in fact, because we'll give you enough of IT and artificial intelligence and programming and data management so that you can work in any environment, in fact. So you will not be a software engineer at the end, but you will be able to develop some programs related to IT. Okay, and next slide, please. These are some of the competencies that we will give you and some of the jobs or the tasks that you will be able to conduct. Like, for example, something that is very important is to collect and clean data sets. Before we can do a data analytics, we need to collect the data, and it represents 60 to 80% of the work of people who are working with health data and data in general. You will be able to choose algorithms and visualizations for data analytics. You will be able to assist medical doctors, pharmacists, radiologists in using software that they need, in fact. And then you will analyze medical or business data for insurance company, because we are also working with insurance companies. And you will be able to participate to drug discovery if your background is related to this and you are interested in this. You might be involved in telemedicine teams because it is a very important business that is growing at the moment, and Dr. Raymond Choy will explain to you this. And you might also be able to develop or manage hospital clinic information systems. This is what I've done in France some years ago. I developed a big information system for a clinic. And this is very interesting as well. Okay, so I think this is, yeah, just a brief presentation of Dr. Tan Ision and myself. So there are some other people who will be involved. Dr. James, who is in charge of foundation science, Prof Leong, who is director of the Institute of Research, and some of the professors in IMU will be involved as well in some of the modules. So don't worry, we have a very good team, very experienced, and it will be the best for you. Thank you very much. Dr. Raymond, I think it's up to you now. Your mic.
Hi, sorry. Thank you, Prof. Yeah, so good evening, everyone. My name is Raymond, and I'm the co-founder and CEO of Doc2us, which is a telemedicine platform. So honored to share a little bit with you on in terms of the industry on application of informatics and technologies and digital health and whatnot, right? So next, please. Okay, so when it comes to all these technologies, Prof has been mentioning about the whole course structure, right? So why would you go into health informatics, AI, data analytics in healthcare? There must be some pain points that we are trying to solve, right? So in healthcare segment, there are many pain points, not only locally but also globally, right? Next, please. So look at the pain points. I'm sure everyone is quite more or less well aware. We have a silver tsunami, which is aging population coming, right, and it's getting worse and worse, and rising cases of chronic diseases, and our healthcare costs and insurance premium are getting more and more expensive. And in Malaysia or some part of Southeast Asia country, right, and where a lot of patients that self-medicate without proper medical inputs, or they go to pharmacy to get medication without prescription, things like that. And in some part of the world, or Sabah, Sarawak, for instance, in Malaysia, right, and there's still areas whereby patients are having issues or difficulties in assessing quality of healthcare services. And of course, right now, the other biggest pain point, which is a pandemic outbreak, right, COVID-19, which everyone is dealing with and is affecting almost all sectors and all industries, right. Next, please. So what are the solutions, right? These are not the total solution. This is just part of the solutions. So of course, you can actually create technologies and platforms and whatnot, right, to actually address issues like connectivity. So you can provide connectivity so they can actually connect to the patients, the healthcare providers and patients, that kind of connectivity, or between healthcare providers and healthcare providers, a peer-to-peer kind of connectivity or communication using tools and technologies, right? Of course, your systems, all your technologies and platform solutions must be cost saving, because as we know, one of the pain points, the cost is getting more and more expensive, right? So how can we actually reduce the cost by leveraging on technologies, right? And the other thing would be, for patients, for healthcare providers, for the industries, how can we actually provide a seamless approach, a more convenient, approach, in terms of value proposition, right? Convenience and safety, all actually being built by, the technologies itself, right? So technologies can do so many things. Of course, they are the enabling tool, they are the catalyst, but it actually has a huge potential in improving all the pain points that we've been talking about, right? Next, please. Right. So conventionally, in terms of medical practice, right, and you and I know that how would we actually go and see the doctors, right? Next, please. So conventionally, you are not well or you need to refill your prescription, you go to see the doctor physically, right? And the doctors will do a history taking, we call it, right? So doctors will ask you a lot of questions, and then they either write it down or maybe they put in the electronic medical record, and subsequently they do a clinical examination. So they examine you and check your blood pressure, things like that, right? And then they, if it's deemed needed, they will do blood tests or urine tests and swab tests and whatnot for investigation or even imaging, right? So like X-ray or CT scan and whatnot. And only then they can come to the formulation of the diagnosis, right? So when they come up with the diagnosis, they come with treatment, right? Treatment, they give you medication, surgery, or non-therapeutic or non-invasive procedure, things like that, right? And then subsequently you go home and then you come back to see them again for follow-up. So this is a conventional way of in terms of health seeking behavior and how we deliver the care to the patients, right? Next, please. So what will be the new practice for today and even tomorrow, right? So next, please. So it's really about collaborations in between the what we call the 4 Ps, right? So if we are able to collaborate all these 4 Ps in a more seamless approach through an innovative process, workflow and technologies, I think this will be the today and tomorrow's healthcare services that we want to deliver to the patients. So first, you have always the policymaker, the regulators, right? So how can we actually collaborate and integrate with each other? That is something that we really need to work hard. And of course, in the whole ecosystem, you cannot run away from the patients. Providers are all the healthcare providers, be it the allied healthcare providers, the doctors, the specialists, the GP, the pharmacy, dietitian, and whatnot, right? And also the other P where a lot of people might have overlook, which is our payer. In the healthcare system, we need to look at the payer, who is the one paying for the healthcare services, right? It could be out of pocket, it could be the National Universal Insurance Scheme, it could be from the insurers, and it could be from the employers for employee, things like that. So if we can actually collaborate all these 4 Ps and making sure that it's innovative, a lot of pain points can be solved actually, right? So next. So if you dissect it down, a better healthcare system that I believe in, right, is actually on top is always the patients. Is how can we bring our services, right, revolving around the patients, right? So by using technologies, how can we actually deliver a safer healthcare service, right? A swifter, which is more convenient, smoother, things like that, right? Less waiting time. A surer means we are practicing updated evidence-based medicine to ensure whatever the healthcare providers are practicing is of evidence-based, is safe, accurate, and precise, right? All through technologies, to data analytics, to AI and precision medicine and whatnot, right? And all this actually, all provided by the 3Ps here, right? So the policymaker, you need to really be more forward thinking. How can we provide the technologies, and enabling the patient to actually engage with the healthcare providers is a more seamless, safer, swifter, surer approach, right? Likewise, the providers, the payer as well. So it's all integrated services that we're talking about, right? And this is what I define as a better healthcare system. And if we actually have a formula or definition, right, really we talk about, value-based care services, right? So I always say, value-based care services is actually defined as, the quality of care multiplied by the outcome of care divided by the cost of care, right? So the values of the service of the care is actually very much dependent on these three, indices, right? So if the lower the cost, the better the value, right? So the better the quality or the better the outcome of care, the better the values. So if we actually, look into the value-based care services, this is what the indices we should look at by leveraging on all this, what we're talking about, right? Next, please. Okay, in terms of technologies, there are plenty of them in terms of healthcare, right? So your AI, blockchain technology in your medical records, 5G is coming, and cloud computing that is more scalable. So you have genomics, robotics, drone tech, to deliver medication, to deliver blood samples and whatnot, deliver healthcare during drone technology, which is on its way, right? And of course, you have a whole range of telehealth and IoT devices and whatnot. Next, please. Okay. So this is ecosystem, in Malaysia, we are from doctors and the telemedicine platform. So we actually have created this ecosystem for the past few years. So we have teleconsult where you actually provide the online consultation services to the patients, and you have a whole range of the online pharmacy solutions that we provide to our pharmacy partners on the e-prescription, e-prescribing, e-dispensing. On the left side is really about offline services, which is the all the physical care services that we provide to the patients and clients. So this is a hybrid care model where we provide online to offline, offline to online, and on top is really about digital healthcare kind of services like the advisory, health articles and whatnot. Yeah, next please. And next please, this is all the offline care that we provide, which is you have a medical outreach team. Next please. So we have a house call services, next please. And we do corporate vaccination programs for the school, for the companies. This is really the offline services that we provide. So in healthcare we cannot do everything online, right? So even though we are talking about health informatics, right? So really about how can we actually bring online or technologies to enable the offline services, right? Which is our physical care. Next please. Okay, so the vaccination program we provide to our customers. Next please. And we do COVID-19 PCR tests and one of our corporate for factories as well. So all these are offline care. Next, please. Okay, so in terms of COVID-19 outbreak, it affected everyone, right? So next, please. So since last year, we actually rally, a group of voluntary healthcare providers to actually step forward to provide virtual health advisory on COVID-19 related matters to the public for free. So public, if you have any questions, queries about COVID-19, be it the risk itself or what to do next or the vaccine itself, you can actually consult online healthcare providers, and then they will be giving you the real-time informations by our healthcare providers, and we can only do that through technology. Next, please. Yeah, so we rally more than 120 voluntaries, healthcare providers. Yeah, next, please. So we also integrated with MySejahtera app to provide the virtual health advisory to the MySejahtera community. So for MySejahtera is a national contact tracing app, which it involves a lot of technology behind, right? So how can we actually plug in the telehealth or the virtual health in it, and so that it makes it a more like a super app kind of thing. So this is what MySejahtera is working at the moment, and they'll be working towards from cross industry in the future as well, right? And not only in healthcare within the app. Yeah, next please. Okay, some of the healthcare providers even have a psychologist. So next, please. Okay, so the MySejahtera app, there are millions of people inside, and just to give you some figures, Android itself is more than 10 million download for MySejahtera, which is of course we are forced to do so somehow, but it's a good app to actually trace our people in terms of where they go in terms of contact tracing, right? Next, please. Okay, so because of my structural integration, it actually brought a lot of patients and and users to our site for general inquiry about COVID-19. So we provide 24 hours kind of services to the public for free. So this is how we actually help the country and to curb down the COVID-19. A little bit of efforts from us to actually help KKM, Ministry of Health, and the hospital as well. Yeah, next please. And in terms of telemedicine adaptation and adoption, prior COVID-19 actually wasn't that great. It was slowly, gradually, increasing, but the pace was too low. But COVID-19 is a big hit to the healthcare industry as well, and you see a lot of private hospitals are not seeing, so much of patients, because of COVID-19, right? And a lot of them roll out, telemedicine. So across the region, across the globe, we saw huge adaptation and adoption of telemedicine. Next, please. Which I'll show you. So this is a survey done by Bain and Company, right? That they actually survey people that for the next 5 years, how likely will you be using technologies? You see, you look at the red bars, they are actually double or triple fold that actually people will likely to use telemedicine in the next 5 years. Digital solutions, online pharmacy and whatnot, right? Next, please. Yeah, so you look at in China adoption of telemedicine is crazy, right? So the largest provider is called Ping An Good Doctor, PAGD, right? So because of this COVID-19, you look at the new users, the adoption rate, right? It went up to 900%, right? They're dealing with hundreds of millions of people, right? On telemedicine on a daily basis. The traffic is crazy across all these platforms in China. Next, please. And how about in South Asia? You look at Southeast Asia, Singapore, Indonesia, Australia. During this COVID-19, we saw across more than 100% of adoption. And in Malaysia, easily we're talking about most of the players. We're talking about 40 to 70% increase in adoption during the whole last year of in terms of adoption of telemedicine services in Malaysia. Next, please. Okay, so this give you the idea of pre and pros COVID-19. So it's all these countries, they are really working towards a high adoption of telemedicine. Hong Kong and South Korea, they are not adopting so much because of the regulatory restrictions and limitations, which I think they are working towards that. But by and large, you look at Singapore, China, Australia, even Indonesia, right, and Japan, they are really moving towards telemedicine, telehealth because of COVID-19. Right, next, please. Yeah, so this is some of the landscape published in The Age, I think 2 years ago. Some of the players, online booking system, telemedicine, or even physical care services providers. So some of the landscape that we can see. Yeah, next, please. And of course, in healthcare, right? Whatever we do, you have all sort of technologies, health informatics, AI, blockchain and whatnot. And at the end of the day, we are providing healthcare services, right? I think the first rule of thumb, as any point of time, right, is really do no harm, no matter what, no matter how innovative we are or how disruptive our solution is, right? First rule of thumb is always do no harm, yeah, and really to bring the values back to the patient. Okay, next, please. And this is from the medical legal in the industry, right? Whatever we are trying to do, right, after your let's say you finish your health informatics and course and whatnot, right, and you have an idea that you want to innovate, right, and to improve the healthcare services, whatever you do, right, and as long as it's not enforced by law, what is not forbidden is actually allowed. So that actually gives us the space to innovate. But again, it backs to the first rule of thumb: do no harm to the patient, whatever solution that you're trying to create. Yeah, next, please. Yep. So that's all from me, and which is from the industry point of view, from the industry perspective on technologies and digital health and the impact on healthcare during this COVID-19 and whatnot. Yeah, thank you.
Okay, so the session is open now to questions, and if you have any questions, we will try to reply. So I'm checking the chat. Any questions from the audience? So as I mentioned earlier, the Health Informatics and Analytics programs, the master programs, will start in September. It will be launched in September. And we are working on some other programs related to digital health that will come later after approval. So any questions from the assistants? From the audience? Yeah, you can ask questions about either related to the programs or related to health informatics in general, digital health, telemedicine, related to what Dr. Raymond was presenting just now. Huh? So don't be shy, go.
Yeah, I think Prof, there's one question. Maybe I'll read it out for you. So there's one attendee saying that, I'm not from a healthcare background. Can I join the program?
Yeah, I didn't see, okay, sorry. Yes, of course. Yeah, this program, as I said at the beginning, this program is open to people with a bachelor degree. Whatever the background, in fact, it can be healthcare, can be IT, it can be business, it can be anything. Because we have two electives at the beginning of the programs related to computer science and statistics. And at the same time, we have a core module that is called Health System and Informatics, where we explain the background, health systems in general, the health system in Malaysia, but in general as well. And so everybody will be on par and be able to follow the rest. And what is important is that the modules will be given in sequence. So first we have health system and informatics together with the computer science and statistics. And after that, we will move, only after we have introduced this, we will move to the second core modules on data preparation and cleaning, and then data analytics, and then data management. So we don't have everything at the same time. It would be confusing and it would be very difficult to follow. So in fact, there will be 4 to 6 weeks, depending on the module, 4 to 6 weeks for each of the modules. And all the contents will be online, but we will have face-to-face sessions as much as possible, depending on the situation in September, so in IMU. And if we cannot meet face-to-face, then we will do support, consultation, and group classes and group projects online, and we will use emails and chat session with Zoom, Teams, anything. Yeah.
Yeah, so thanks, Prof. Since I'm like the moderator now. There's another one, IMU team. Thank you for your invitation. In fact, I'm not sure how you get my email address. Prof Patrice and Dr. Raymond, thank you for sharing. May I know what are the differences and similarities between this program with Master Science in Data Science, AI? Thank you.
Okay, so this program is focusing on health data, but the contents are very similar to a master in data science or what you find in other universities, but we focus on the health data. So all the examples that we give, the projects that we give to the students will be related to health data, but the algorithms will be the same, data management will be the same. And so at the end of this program, you might be able to find a job that is not in healthcare or related to healthcare. You will be able to deal with the data sets related to business or to any other field.
Yeah, so I think the other two questions are quite similar. Someone without IT background and with business degree, they're just afraid that they are not able to pick up the basic IT skills. Can they join?
Yeah. As I said earlier, we have an introduction to computer science and programming at the beginning of the program, intensive, and we will not make you become software engineer. You will not be able to develop a big software, but we have experienced this because last year we have done a CPD on continuous professional development in 3 days using Google Colab, which is a online platform, and you can use Python. So we introduced Python to people and SQL, a database query language. And in 2 to 3 weeks time, you get the basics. Of course, you have to put some energy on it, but you will get the basics and you will be able to understand and to practice. We will make you practice. And the basics of programming are not that difficult, especially with Python. Python is a quite easy programming language. And It's not that difficult. Of course, if you want to do C++, then you will be lost. Huh? We don't want you to become lost in a difficult programming language. So starting with Python and SQL is okay. I have taught this Python for many years, and if you have the intention of succeeding, no problem, you will succeed.
Okay, thanks, Prof. The other question is, someone say, if I complete at postgrad certificate in 2022, and then later in 3 years' time, is it possible?
Yeah, you can do it part-time. Huh? You can do the program part-time. So you can, you have to check with the admissions how it works. But yes, you can enroll in some modules at the beginning, and then you can do more later. This is a possibility, yes.
Okay, if someone with a postgrad certificate holder in data science joining this program, is it possible? But no degree from Malaysia University.
Yeah, of course it's possible, but I'm not sure about the, you know, we have in Malaysia, there is APEL. It's you can ask, in fact, you have to ask MQA to validate your experience, your previous experience. So I'm not sure how much you can get validation or yeah, for this, but of course you can join, no problem.
Okay. Is it possible to continue 3 years later? Which you answered already, right?
I think part-time is possible because part-time it's 2 to 6 years. But maybe the contents will have changed a bit in 3 years' time, but it's okay.
So right now, the course is designed for part-time or full-time or both?
Both. In fact, it's designed for full-time, but if you want to do it part-time, no problem. You take some modules at the beginning, and you will take some other modules later. We are also working at the moment on what we call micro-credentials. That is parts of modules, because one module is, the core modules are 4 credits each. So it might be, for some people, it might be a bit difficult. And we are looking at the possibility of preparing micro-credentials, that is 1 or 2 credits only. So you would have part of a module, and then you could do it later if you are very busy with your work or your family. So it's,
Okay,
yeah, it's quite flexible.
Okay, good. I think a very good relevant question. Any scholarship given?
For the first intake, yes, there is a bursary of 5,000 ringgit because the program is 40,000, I think, for 1 year. And for this first intake, there's a bursary of 5,000 ringgit.
Good. And the next question is, how's the lesson hours like? Is it weekdays, daytime, or this? Yeah.
No, most of the classes will be on Saturday. So it means that most of the support will be on Saturday, either face-to-face or online. But we will also use emails and Teams and Zoom session as much as possible when students need to be assisted, because we know that doing online, working online is not easy. So we are also very busy on using with all these online sessions, but we will help students online, even on weekdays in the evening, possibly.
So the course itself is not so intense, so it's a weekly, only on Saturday, is that right?
Yeah, but you have to, in fact, students have to learn by themselves also, because we put online some contents like videos and some articles to read and slides, and then we will explain, but the students have to work by themselves as well.
Okay, got it. It's like a problem-based learning, right? PBL type.
Yes, problem-based and what we call blended learning. Yeah?
Okay, good. And the next question is, what are the common research topics of this program?
Research topics, you mean for the second semester? In fact, we have not decided of any topic at the moment. It will depend on the background of the students and in what kind of topic they are interested, because we are working with different people inside IMU. Some are working on nutrition, others are working on dentistry and different fields of medicine, and so it's very open. But even if you are working in a hospital and you are interested in a specific topic, you can submit it, and we will tell you if it's good enough, or maybe extend a bit if it's too small, so that you can, it's easier for you, in fact, to work on this topic.
Thank you. So can someone work full-time while studying this program?
Yeah, it's always the same. Yeah, it's possible, of course, because the classes will be only on Saturday. But if you have a family at the same time, full time might be difficult. But if you are able to put it sometimes in the evening to learn to read the lectures, to watch some videos, then yes, it's possible.
Yeah, I think that's a power of technologies where you can do everything, a lot of things online.
Yes,
So
yes.
not necessarily you need to quit your job for this course,
No,
right? Yeah,
but it depends how much time you can put on it. Huh? It's
yeah.
always
It's
the
really
same.
about how you juggle.
Yeah.
Yeah. And what's the difference between part-time and full-time?
Full time, you take all the modules in sequence. That is, you have 4 core modules in the first semester and 2 electives. And the second semester, you have 2 core modules and you have a research project. So if you would do it full time, you do all of this in 2 semesters. And if you do it part time, then you will take only some modules. But you have to be careful because the modules are in sequence. So you can take 1 or 2 modules the first semester, then you might take 2 other modules or 1 or 2 modules the next semester. So it's possible that in fact, if you take only 1 core module per semester, we have 6 altogether. So that would be 6 semesters. So it's still feasible.
Oh, that's good. I mean, it's very flexible, right? After all. Yeah, that's good. I think the next question is for me. What are the challenges in the digital health in Malaysia? I think that's a very good question. I think that the challenges are quite similar in most places. We cannot run away from regulations. Like it or not, healthcare is the most regulated industry in Malaysia, and in the whole industry, right? So when there is no proper regulatory framework, that comes a big challenge when you want to innovate and disrupt the industry. And the other challenge will be infrastructure, right? So let's say in Malaysia alone, we do not have a very good comprehensive infrastructure for, let's say, digital health. When I say infrastructure, it's not really about the hardware, like the 5G tower and whatnot. Those are one of those, but you also have a software, the talents. That's why you need to go for all this, health informatics. We need more talents, right? And apart from that, the funding scene, right? The funding landscape in Malaysia is definitely not as good as, for instance, Singapore, right? To fund the projects or research that you want to do in terms of digital health. And as well as the whole ecosystem is not really ready yet. So hence these are all the challenges, and the last challenge would be the readiness, right, of a usage, right? So be it healthcare providers or the patient themselves, right? And we are not ready to actually fully adopt digital health. It's really on gradually. But of course, COVID-19 actually sped up the whole process of adoption. So which is a very good example on when there's a good trigger, and that's why people adopt, right? And these are the some of the challenges that actually most of digital healthcare providers are facing. Yeah, I hope I answered your question, Jane. Okay.
There was a question from Nick. Yeah, it's possible to start full time and then change to part time if you cannot follow full time. Yeah, it's possible.
Good. So the next question is, how do you see the future of this industry, digital health, I suppose, right? I think the COVID-19 has actually taught us a lot of lessons, a huge lesson, right? That digital health has its values in actually providing a proper healthcare services to the patient, to the to the healthcare provider, to the industry as well. So the future definitely is really bright, and we are very positive about this whole digital health as an industry. But again, it has to be a collective effort that from all the stakeholders, as I mentioned, the 4 Ps, right? The provider, the policymaker, the patient, and the payer. All 4 must work closely together, collaborating with each other, right? To move this this space together to the next level, right? But we are very positive because we saw a lot of positivities, right? After this COVID-19. So hence, I think the future is bright. But it comes with a lot of challenges, as I mentioned before, which can be mitigated. Yeah. Okay. And next, in regards to digital health, are there any laws in place or okay? So in terms of digital health in Malaysia per se, that digital health itself, right? There's no enforced law at the moment. And so the government, the Ministry of Health, is trying to come up with something we call the Online Healthcare Services, OHS, where they actually consulted the consulting firm last year to study the whole landscape, involving all stakeholders, be it the grassroots startups, the regulators, MCMC, MMC, MOH, and insurers and whatnot, right? To come up with a regulatory framework. Supposedly it should be out this year, Q1, Q2, but because of COVID-19, it got delayed. So the government, the MOH has intention to have a regulatory framework or even to enforce acts, right, for this OHS, because we are seeing a mushrooming of digital health providers coming to the space, right? When it comes to healthcare, it has to be safe, it has to be ethical and professional. Hence, this space needs to be regulated, especially telemedicine or telehealth. As of now, as we say, there's no enforced act. Everyone is self-regulating. You may find in Google, we have a Telemedicine Act 1997, the blueprint, which is not enforced, and it was actually written by the DG Dan and also the chairman of IMU, Tan Sri Abu Bakar, but it's not enforced yet. And yeah. Next, is it me? Okay, next is it for Prof, I think. Yeah. Is there any industry placement training required and arranged by IMU? And what are the percentage measured in terms of project and exam assessment 50-50? Thank you.
Yeah, okay. During the second semester, there is what we call a research project, but it's some kind of placement. It can be done in industry, it can be done in IMU, and we call it research project, but it's a 20 weeks, at least 20 weeks project. You propose a topic, or if you don't have a topic, we will propose you. And you have to write a report and do a presentation. And it can be related to your work. If you have something that you want to propose related to what you are doing. Yeah.
Yeah. Thank you, Prof. And the next...
I forgot something. Yes. There are very few exams. In fact, we don't believe so much. Personally, I don't believe so much in exams. So it's mostly group projects, individual projects, and assignments. And this is how we give marks and we evaluate the students, but not so very few exams, in fact.
So does that mean, follow up on this, right? No exam. Does that mean that it's going to be easy to come out or pass out from the program itself?
It doesn't mean that it's easy, because you have to do the assignments and you have to do good projects. But I think it's a better way to assess the quality of the students and the quality of their work than exams, because I've got more than 40 years of experience, and I don't believe so much in exams, personally.
Yeah, neither do I. Thanks. The next question is, I think it's for me, right? How you see our current ICT infrastructure helping or slowing down adoption of the digital health? Thanks for the question. I think it's a very good question. And I think at present, our current ICT infrastructure definitely has improved, right? If you compare to 5 years ago, but we are still very much behind to a lot of countries, even in Southeast Asia, right? Well, I give you an example, Singapore, of course, right? Everyone's aware. And if you look at Vietnam, they are very, very much ahead of us in terms of ICT infrastructure. And when I say infrastructure, it also includes the regulation part as well, right? The policies and things like that. But definitely we're looking, we are moving towards that, right? And but the pace might not be as fast as other countries. Like Vietnam is really booming in terms of the ICT area. And one of the main issues is actually talents, right? We are definitely lacking of talents in the ICT side of it, and if you see a lot of big companies, the IT companies, right, from Grab or Facebook and Google, yes, we are companies rooted here, right, but they're headquartered in Indonesia or in Singapore, right? You might wonder why. One of the reasons is we do not have enough talents, right? And in Singapore there are a lot of talents. The policy of welcoming, get the foreign talents to come in, right? And of course it comes to the cost as well of the talents and all this, right? And definitely I think we need more talents. Hence, we need all of you, to come to this course, right? And to understand more and to really, understand the ICT, and only then we get more and more talented people to help the country to move. Because when it comes to health tech or digital health, right? Yes, healthcare is a big part of it, but we also need the digital part, the IT part of it, right? The data scientists, analysts, right, and whatnot, right? To really work closely together with the healthcare providers to move the industry, right? And hence we need a lot of talents too. Yeah. Okay, next, is it possible for me to work in the hospital with this degree? Prof?
I think yes, it depends on what kind of job you want to do. Yeah, because personally, I've worked with. I had no background in healthcare before, and when I was in France, in Paris, I worked with medical doctors during a few years, and I developed a medical information system. At that time, I was alone, and there were very few medical information systems in hospitals at that time. So it's something that you can do. You can be involved in developing an information system, in collecting data and cleaning data sets. You can assist the doctors, explain to them how to use the software or maintain the software. There are many possibilities, in fact. I think Raymond can also tell you about this.
Yeah, absolutely. Yeah. So I mean, definitely, it's definitely you're possible for you to work in the hospital with this degree for sure, because there's still a lot of the exit points actually is quite diversified. Not necessarily you need to work in the healthcare industry. You still can work in other industry, not only confined to the healthcare. But of course, this course is actually designed more towards healthcare, but that doesn't mean that your skill set are not able to apply to other, let's say, telco company, oil and gas company. Yes, you are. So at the end of the day, it's still data, informatics and whatnot. Yeah. So it's very flexible to me, I think. Yeah. Okay, so next is me. Oh, from Jane. How do you address privacy issue in the world of digital? Yeah. That's a very good question. When everything is online, connected in the internet, in the cyber world, that there's always a risk, right? So no matter how secure the system is, right on top of cybersecurity, is a huge challenge to the big giant company. You talk about BAT in China, you have Facebook, all this, right? Google, and privacy issue remains one of the main issue, right? And which will involve the cybersecurity of it. And hackers are always in front of cybersecurity, and somehow cybersecurity is more reactive. And of course, we want to be more proactive, right? And it's very challenging. So the privacy issue actually, as long as you're connected, right, you are actually subjecting yourself to the risk. But it really brings down to how we manage our privacy, our data, right? It's not the responsibility and the duty on the platform itself or the government or the provider in terms of healthcare, right? But also on the patient and the user themselves. So it's really about everyone's to actually come together to manage the risk in terms of the cybersecurity and the privacy issue. So if the user patient themselves are not actually taking good care of their privacy or the data, and there will be the breach as well. They are subject to the cybersecurity risk. Hence, it has to be a collective efforts from all the stakeholders, be it the platform providers, the government, the providers, healthcare providers, the healthcare fraternity, hospitals, and the patient themselves, right? Okay, I hope I answer your question, Jane. Yeah. Next is, what are the gap of the medical digitalization trend between Malaysia and Singapore? Will this program be recognized by Singapore for employment there? Thank you. Maybe I can answer the first part, the Prof can answer the second part. The gap is actually, we definitely are 4 to 5 years behind Singapore, and one of the reasons is actually the infrastructure readiness in Singapore. So in Singapore, they are more friendly in terms of the policies, in terms of their readiness of the infrastructure, the regulations, the funding, all this. Definitely they are ahead of us, and also the talents, the hardware, the software, and the people's mindset and awareness and education. So the literacy as well, right? And so they are definitely ahead of Malaysia, at least about a few years ago, about a few years gap. Yeah, but we definitely need to do a lot of catch up. Yeah. Prof, you want to answer the second part?
Yeah, it will be the last question. We won't take any more questions because it's late now. Regarding the question from CPY, this program is recognized by MQA and Ministry of Education in Malaysia. So I think the recognition is good, and IMU has a good reputation. So I don't think it would be a problem to get a job anywhere with this program. Now, is there a risk of misdiagnosis or wrong treatment? In fact, the human will still be there. Huh? I don't see in the near future any software program deciding what will happen to a patient. maybe in 50 years time, but we don't know. But for the next 5 to 10 years at least, and maybe more, probably more, the medical doctor will be the one who will decide. In fact, the software will be helping. It will assist medical doctors, surgeons, and radiologists, and everyone. But the final word will always be with the medical doctor or radiologist or all of them. So there is always a risk. Medical doctors can make mistakes as well, but they will never let the software decide.
Yeah. So to add on what Prof mentioned, the risk is always there, even physical care or online care, right? Digital health. For digital health, is really about how the healthcare providers use that as an enabling tool to make sure that the practice are safer, better, swifter, and also surer, right? Like I mentioned before. So it's definitely not a definite diagnosis and whatnot, and that if we actually provide a proper guidelines and protocols, right, and the risks are very much mitigated. And in fact, if you look at it, right, being in the digital health, it can be safer because it's really evidence-based and updated information, and the continuity of care and the data is always there. So patient, the flow of data is shared in terms of interoperability, right? So some may argue it's actually safer using into digital health services than only offline care. But it's really about the hybrid care. How can we bring online, offline working closely together? And that will help to minimize and reduce all these misdiagnosis and wrong treatment and misinformation risk, really. Yeah. Thank you.
Okay, so I don't think we can take any more questions because it's time now. So thank you, everyone. Thank you, Raymond, and thank you to our colleagues who helped us do this. And thank you to all the participants, and hope to see you in September in IMU, and hope you will register to this program. Thank you very much. Bye.
Thank you, everyone.